How can Canada reduce healthcare wait times by learning from Japan's healthcare system? We're in Japan this week to learn more about their universal healthcare system and how they have virtually no healthcare wait times. Come on, let's go find out.
Japan is an Asian country with 123 million people. That's about 3 times Canada's population. Like Canada, it's part of the G7. It's also the same country that brought us Nintendo, Toyota, and of course, Hello Kitty. The latter isn't so high-tech, but Japan is a country that is known for leading-edge quality products. We wanted to learn more about their universal healthcare system, especially how they don't really have waiting lists. Yes, you heard that right. The country that voted instant noodles the best invention of the 20th century also has instant healthcare. You get it pretty much when you need it. A 2020 OECD report looked at healthcare wait times in 24 countries. They looked at 8 categories of waiting times, everything from diagnostic scans to cardiac treatment, and found Canada tied for last place. We had problems with wait times in all 8 categories, while Japan was ranked in first place, with no major problems in any of the 8 categories. Our first stop was the Kansai region of Japan, which includes some pretty large cities like Osaka and Kyoto. Thankfully, we could get around this region not too bad as I speak a bit of Japanese. I picked it up when I taught English here 20 years ago, back when I had more hair. We thought we would begin by talking with Shirley Zhang to ask about what the system is like for patients. Shirley previously lived in Canada for a number of years and now calls Japan home, so she's used both systems. What have you noticed? What would be the advantages of the universal healthcare system here in Japan compared to what we have in Canada?
The wait time is not very long. Basically, no wait time. You can get your doctor's appointment anytime on the same day sometimes. Yes, I know in Canada it's very difficult. For example, a few months ago I was really sick. So I decided it's time for me to go see a doctor. So I just called the clinic and they're like, oh yeah, we have an opening in the afternoon at this time. You want to come? I was like, great, okay, of course. But I think it's, I asked my friends if that's possible in Canada. They're like, oh, it's gonna take a month.
We wanted to know more about how Japan's universal system differed from Canada's. So we sat down with Professor Matsuda at Ritsumeiken University in Kyoto.
So Japanese health system is universal, so it covers everyone. And the system consists of 2 systems. So one is social health insurance or compulsory health insurance, and other one is tax-based financing, social assistance. The funding mechanism is very complex, but patients overall pay around 15% of the total spending of healthcare from their pockets. Okay. And the remainder is go through the health insurance and tax money. So it's a combination of funding from the government as well as insurance pooling. Yeah.
So basically, if you visit a family doctor in Japan for something like a bad cough, the government pays most of the bill. But you might have to pay a user fee. Professor Matsuda guessed it would be around 3,000 yen, or about $28 Canadian. However, if you require something much more serious, like a heart operation, the government pays almost the entire bill. There are caps to make sure patients don't spend too much in a single month on healthcare. The Japan Times published an article that explains the numbers. If you make about 36,000 to 74,000 Canadian, the most you would spend on the surgery is around $840. The poor would pay even less, so no one is getting bankrupted if you need a major surgery. In Canada, you might not notice it right away, but every time you get a paycheck, the government takes a big cut, and lots of that goes towards healthcare. In fact, we pay more for healthcare in Canada, but they get better service. You have government hospitals and clinics, you have private, and you have non-profit. Do they all work together well?
In my understanding, they work well. Generally. So if they need some refer some patient to other institutions with other specialties, they collaborate well generally.
We also saw this in France and Sweden. They too have private, non-profit, and government-run hospitals and clinics. It doesn't matter which one a patient chooses, the tax dollars follow the patient. Japan's healthcare system is actually less ideological than what we find in Canada. In Canada, whenever anyone talks about having more services provided through non-government health providers, a lot of special interest groups get upset.
We need to keep our healthcare system public.
They want the government to have as much of a monopoly as possible, even though we've seen that Canada's monopolistic approach clearly doesn't work. The secret to Japan's success seems to be their large supply of healthcare. They have so much healthcare available that they're trying to grow their medical tourism sector. They want patients from China, South Korea, and other countries like Canada to come here for treatment. We met with Koji Ogawa with the Osaka Convention and Tourism Bureau to learn more. Canadians often wait long wait times for surgery, so sometimes somebody has to wait a year for their hip operation or knee operation. It's very, very painful for people. Do you know roughly any details about wait times in Japan?
まず日本住んでいる方であれば医師の判断で必要であれば速やかに手術を受けていただくことが可能です。そうじゃなくても大体待ちとしてはもう数週間あれば治療手術していただくことが可能になってます。
Weeks. In Canada, years. Are Japanese entrepreneurs able to start up in the healthcare sector?
まあそれはできる。日本の医師免許を持っているので可能です。
That's understandable. You don't want me doing surgery. I'm not a surgeon. So I'm really looking forward to this next conversation we're having with Dr. Tokuda. He's with the Global Health and Policy Institute. He's also a family doctor, so he's got a lot of understanding about the healthcare system. Now, he's actually down in Okinawa, Japan, which is kind of like their Hawaii. It's farther away from the country. We couldn't go down there and visit him. I would have loved to have gone. They've got beautiful beaches. But we're going to do a Zoom chat with him, and I'm really looking forward to it. Well, thank you, Dr. Tokuda, for taking a few minutes to talk to us today. I'm excited to chat with you about Japan's healthcare system. It's been very interesting for us to learn more about it. One of the things that I find it very surprising is that wait times just are not, they don't seem to be a major problem here. Like in Canada, it seems like you don't really have long waiting lists.
You're right. The free access and rapid access is a major advantage of Japanese healthcare.
Yeah.
We have private hospitals and clinics, and public hospitals, and the people in Japan basically they can see doctors in any hospitals or clinics. You can see doctors today, then next day you can see another doctor. It's your choice.
Yeah.
There is no limitation. You can visit any hospitals throughout Japan.
I think a big part of the solution that we could take from Japan would be just sort of your grassroots approach, where you allow anyone to come in and provide healthcare as long as they're a qualified doctor and meet standards and so forth. Whereas in Canada, it's the opposite. You have a top-down approach. Is that maybe one of the lessons that you think we could learn?
I think the major difference between these countries is the number of beds.
Yeah.
We have so many beds.
Yeah.
Throughout Japan, and the workers, the big hospital, they work so hard.
Yeah.
They see patients, they admit. Waiting time is reduced because of the available beds hardworking people.
Think of Japan's healthcare system as being like a well-run fish market. There's lots of buyers, lots of sellers, and no one has to wait around for 6 months just to talk to someone about buying a fish, and then another 6 months to just actually get the fish. That's because the government isn't micromanaging things here. The government doesn't decide how many fish to sell and then say, too bad if some people don't get fed. Patients in Japan have a lot of choice because the government encourages people to open up new hospitals, new clinics, and other health facilities. And when they do, the government subsidizes most of the bill, whether a patient decides to go to a government facility or a non-government facility. Like this fish market, there's no shortage of options. This is why Japanese patients don't have to wait for healthcare, and why Japanese people don't have to wait for fish.
Before leaving Osaka, I was very excited to visit Isaai Hospital, which is a private hospital that serves the public and patients from outside the country. I'm meeting with hospital director Kazuo Minematsu. I know this is still a new hospital here, but have you had any Canadians come here yet?
Yes.
Oh, really?
One most important one is 私たちはこの病院を単に日本国民のためじゃなくて、要するに海外の人たちのためにもオープンしようというふうに思って実際いくつか準備を進めてます。その話をちょっとさせてください。でカナダ、去年81名81 patient visits one year 81. So averagely 5 to 7.
If somebody came in today and said they need a knee operation here, do you know typically how long that takes?
In emergency cases, that's today. But if we can make a scheduled operation, it probably 1 month.
1 month?
But depending on the severity or emergency.
Do you have any wait times that are measured in years?
Not particularly. No. So this is a Japanese style.
Yeah.
Easy to access.
Yes.
How about in Canada? It's easy.
The government doesn't allow private hospitals.
I see.
So if this is, this might surprise you. If you live in Toronto, our biggest city,
I know.
and you need a hip operation, you have two choices. One is you wait for the government to provide it. Who knows how long? Maybe months or a year. Option number two is you pay outside of the province. You cannot pay in Toronto to get your hip done. The government doesn't allow it. So they restrict supply.
Most Japanese cannot survive.
So we will have a strange situation where someone in one province can pay in another province, and that person in that other province can pay in this province, but you cannot pay in your own province.
I think it should be changed.
Yeah, we think so too. But we have a lot of government restrictions on supply. So when you restrict supply, you have long wait times.
Wow.
And no other country does this. So maybe North Korea. But,
I don't know North Korea situation, but not good.
No, so this is part of the problem. We have other challenges, but we have a lot of good people in the system.
You came here.
Yeah.
It was fascinating to keep hearing that it doesn't matter if you need something like a heart operation or knee operation, you can get treatment right away in Japan. We were excited to learn more during some upcoming meetings we had planned in Tokyo, but before we left Osaka, we had to check out a couple of attractions and some Japanese cuisine. So something that I really miss about living in Japan is all the great food that they have here. There's a lot of really cool things that go beyond sushi and udon, things that are popular in Canada. Yakitori was one I always loved. Okonomiyaki, takoyaki, lots of cool dishes. You might want to look them up.
Back to work in Tokyo, we were off to meet with Dr. Ikeda at International University of Health and Welfare, Mita Hospital.
How long are the wait times
here if somebody needs something like a knee surgery or maybe hip surgery?
だいたい年間360件ほど手術をやってまして、待ち時間が4週間から8週間ぐらいです。ただし、患者さんが特に痛いとかコンディションが悪いとかという時には 2,3 日で手術をすることもあります。
It's a little bit of culture shock coming to Japan and hearing about the short surgeries. In Canada, often people have to wait a year or so to see a surgeon and get surgery, and they often have a lot of pain, and that's why we've come here to learn about Japan's healthcare system.
Yes. How long waiting time while in Canada?
Sometimes a year.
Sometimes a year?
Yeah.
Year?
Yeah. Yes, waiting for a year is bad, but it often gets worse in Canada. The system is actively giving up on some patients and letting them die. Meanwhile, in Japan, there are no waiting lists. Emergency rooms aren't packed to the brim. And they're the ones developing leading-edge surgery with robots that you might have heard about. They seem to have a much more innovative system than what we have. We wanted a grassroots perspective on healthcare in Japan, so we met with a taxpayers organization, Japanese for Tax Reform. If somebody needs something like a hip or a knee operation, do you know how long would it usually take for them to get in to be able to get that surgery?
To get in hospital, maybe 1 or 2 weeks.
So your wait times, if anything, they're in a few weeks, whereas we're looking at months or years.
Unbelievable for me.
Yeah, a lot of patients feel that way in Canada. Are Japanese people generally pleased with the healthcare system here?
I think so. And the doctor and nurse is very kind for us.
So we actually do research into Canadians dying on waiting lists. It's very sad what's happening. We have people dying waiting for hip operations, knee operations, sometimes heart surgery, cancer treatment. People will go outside the country for life-saving treatment. Do you ever hear those stories in Japan?
Never. Never.
This actually brings us to a final point, and that is that people in Japan tend to be healthier in the first place, so they depend on the healthcare system less. And that's because they tend to eat healthier, they tend to get a lot more exercise. So when you're living healthier, you're less likely to develop disease, require joint surgery, have to visit your family doctor, and so forth. It's well known that Japanese people have one of the highest life expectancies in the world, 84.5 years versus 81.6 years in Canada. That's an extra 3 years of life. But what is also important to look at is something known as healthy life expectancy. That's the number of years someone lives without disease or disability. While Canadians came in at 69.8 years, Japanese people came in at 73.4 years. In Japan, healthy living actually begins at a young age. I can remember when I taught English here 20 years ago, at one of the schools I taught at, there was one occasion where some boys, they broke a window and they didn't really get in trouble for it. And I thought, wow, this is kind of surprising, it's kind of a serious thing if you break a window. But on another occasion at the same school, there were 2 girls that were getting in trouble and the teacher was giving them a real stern talking to. And I thought, wow, I wonder what's going on there. So I asked the teacher and she explained that one of the girls had gone to another city and brought back some treats, I think some chocolates or something, and she gave them to her friend at school. And this was a huge no-no. You were not allowed to bring in junk food to schools. There's no vending machines in schools selling chips and chocolate bars. You can't drink soda. They just don't allow it in schools because it's deemed to be unhealthy. And that's actually just a huge difference. They also often have nutritionists in schools to help teach kids at a young age about healthy diets and so forth. I'm curious about the prevention side of healthcare. I mean, Japanese people are very, very healthy. It's quite different from in North America where we have significant challenges with people and their health because of lifestyle decisions, diet, maybe a lack of exercise, those types of things.
Are there any government policies that you think are helpful that encourage healthy living in Japan, or is it mostly sort of a cultural thing?
Yeah, I think they are both. Government issued guidelines for healthy lifestyle for prevention. A lot of recommendations. Yeah, stop smoking, moderate drinking, exercise more, something like that. And also Japanese culture, we eat more fish, and usually in urban area, people usually walk, between stations, subway stations or JR stations, and bicycles.
Well, I've got to say it's been an incredible week here in Japan. Just awesome to be back in the country, learn a lot more about the healthcare system, squeeze in some sightseeing. And I got to say it's been a bit of culture shock, just learning about the healthcare system and how they don't really have waiting lists here in this country. We just kept hearing that again and again and again. Very different from Canada, obviously, what we're facing. With that in mind, I think there's two big takeaways for Canada when it comes to fixing our healthcare system. The first would be just sort of Japan's approach to increasing the supply of healthcare, welcoming people to open up a clinic or maybe a hospital or whatever. Very different from Canada's approach where the government tries to control things. The second big difference, of course, would be on the prevention side. Just people living healthier lives, and the government has some policies where they try and nudge people towards healthier living. So with that in mind, we're finished. Hope you've enjoyed this, and I hope you have subscribed to our social media pages. And if you want to learn more about health reform, you can visit healthreformnow.ca. 終わりました。さよなら。